We're going to interrupt this now to take you live to Victoria Health for an update.
Today is the 50th straight day that Victoria has recorded 0 community transmissions of the coronavirus. That's an amazing achievement given where Victoria was just a few short months ago. That's a precious but wonderful achievement, and I want to thank all Victorians for their efforts and reassure them that the Victorian Government and the Victorian community will take all steps necessary to protect that hard-won gain. And of course, as we've seen in recent outbreaks in Sydney, this pandemic is far from over and still has a long way to go. This pandemic isn't over until all Australians have been vaccinated, and that is a long way away. So just to run through a few things. Today, we've recorded 2 internationally acquired cases of coronavirus. One is a teenage girl and one is a woman in her 30s. Both are now in hotel quarantining. One of these cases was diagnosed as a member of an international flight crew who was quarantining in a hotel at the time of her diagnosis. That crew member arrived in Australia on a crew-only flight with no passengers. The other members of the flight crew all tested negative and have since left the country also on a crew-only flight to complete their quarantine in their home country. One local close contact who transported the crew from the airport to their hotel has been identified, and that person is now required to quarantine for 14 days. This brings the number of internationally acquired cases since Victoria commenced receiving international arrivals to 10. So just a few comments on the New South Wales situation. We now have a permit in force for all New South Wales residents travelling to Victoria and residents from other states travelling through New South Wales to Victoria, and Victorians who have visited New South Wales and are returning home. It came into force at midnight last night. Anyone who tries to enter Victoria from the Northern Beaches and other New South Wales exposure sites, the red zones, will not be permitted to enter. If passengers do arrive from a red zone, they will be transferred to hotel quarantining for 14 days for the duration of that quarantine period. Anyone travelling from Greater Sydney region, the orange zone, is encouraged to get tested on arrival and self-quarantine until they receive that negative test result. Those travelling from regional New South Wales, the green zone, are permitted to enter and go about their business, but are asked to monitor for any symptoms. All travellers will be asked to carry their permit when flying, and the flights are being met by members of our public health teams, be that at Tullamarine Airport, at Albury, at Mildura, at Bendigo and at Avalon regional ports. So far, some 52,000 permits have been issued since midnight. That's at the rate of about 250 permits a minute. There is, of course, significant risk that COVID-19 has seeded across the Greater Sydney area. If that is the case, and I stress that's an if, then we will have no choice but to declare all of Sydney a red zone. That will mean anyone who has been in Sydney will not be allowed into Victoria. My message to everyone in Victoria is don't go to Sydney. And if you are prepared to do so, then be prepared to be stuck there for at least a period of time if the red zone designation expands to Greater Sydney. In regards to the operations at Melbourne Airport, 2 unaccompanied minors arrived from the red zone this morning and have now gone into hotel quarantining with their carer, who was self-isolating in Victoria after yesterday's announcements. That means that that family from the red zone will be spending Christmas in hotel quarantining. So my message to anyone in the red zones of Sydney is if you come to Melbourne, you will be spending your Christmas in hotel quarantining. That's not a position we want anyone to be in. Testing sites have also been established for travellers At Tullamarine Airport, there's a testing site at Terminal 4 for domestic arrivals. That's been operational from 9 a.m. At Terminal 1, there's a domestic site for domestic there's a testing site for domestic arrivals, and that will be operational from 2 p.m. There's also a testing site at Building 64 at the airport for airport staff. Testing will also be available at Avalon, Mildura and Bendigo when flights are scheduled to arrive at those ports. The Health Department has been contacting all airline passengers who arrived from New South Wales and arrived into Victoria after the 11th of December. Any passenger who has travelled from the Northern Beaches and other New South Wales exposure sites from the 11th of December will be required to get tested and self-quarantined for 14 days after the day they were in that the latest date they were in that red zone. Text messages have been sent out to 11,000 arrivals in those periods between the 11th and the 17th of December, and a further 7,000 are going out as we speak. The COVID-19 accommodation program has accepted a frontline worker and a community member into the emergency accommodation as a result of those messages. The frontline worker is a Victorian healthcare worker who is a close contact of the Northern Beaches cluster and was not able to safely isolate at their own home. And the community member recently arrived in Melbourne from Sydney. They are also a close contact of a Northern Beach cluster positive case and were also not able to safely isolate at home. Emergency accommodation is available for people in Victoria or who have travelled to Victoria from within Australia. If you need support to self-isolate or to quarantine, it is available. So just in regards to the situation in Sydney more generally, we can't rule any actions in or out when it comes to further tougher measures that might be needed. Those tougher measures will be on the basis of the public health advice. We are working very closely with our New South Wales and interstate colleagues, literally a hour-by-hour monitoring of the situation. And when the public health advice changes to take further action, we won't hesitate to do so, because we want to make sure that Victorians have a COVID-safe Christmas, and that precious thing that we have established of 50 straight days of COVID-free in the community transmission is protected and built on. And that's a challenge for all Victorians, but it's also a challenge for our friends and colleagues and family members, particularly in Sydney, and we'd ask them, please don't come to Melbourne, please don't come to Victoria, and Victorians, please don't go to Sydney. So I'll ask Professor Sutton to perhaps give a public health advice on the matter. Thank you.
Thanks, Minister. So obviously the situation in Greater Sydney continues to evolve. There's been an update from the Premier and Chief Health Officer there this morning. Additional cases overnight, as you know, 42 is the total number of cases, including the case that's in Queensland associated with the Northern Beaches cluster. There will be further cases through the course of today, as has been flagged at that morning press conference. We need to check in on what those updates will mean for us. Really, it's a question of how concentrated those cases are in the Northern Beaches area. There are new restrictions that are now mandated for the Northern Beaches that will obviously help to control transmission there, but cases may well be outside of that greater Northern Beaches area. So if that's the case, we'll need to review that. We'll need to see what settings they might have been in, how many people might have been exposed, and therefore what the risk is in the Greater Sydney area as it applies to our current orange zone and the permit scheme. If there is transmission in the Greater Sydney area, we obviously need to reflect on that, and as the Minister has indicated, what that might mean for a permit scheme or a prohibition of people coming from Greater Sydney. But at the moment, it's very strongly concentrated in the Northern Beaches area in Sydney. That's a good thing in terms of managing transmission. But in recent days, people have moved about a great deal. and that may well mean that there are some settings outside of that area where other individuals have been exposed. Not everyone with COVID-19 is infectious, and so people can go to some of these so-called exposure sites and no further cases occur. But if someone's infectious and they've been to a place with a great number of other people, then you can certainly see spread outside of those settings. So we just really need to follow that moment to moment and make a judgment through the course of today and the rest of the week.
So, any questions?
Minister, you've spoken a lot about airports. Presumably, as we speak, there's thousands of people driving down the Hume from Victoria to try and make it into Christmas. What is being done at the road borders?
At the actual borders, all people from New South Wales or coming into Victoria, regardless of where they're from, are required to get a permit. That's the first issue. And in regards to the policing of those, as we indicated yesterday, there are random spot checks being taken by Victoria Police, not on the hard border, but back further into Victoria, so as to make sure that our regional border communities can function as effectively as possible. That's based on the risk advice that it isn't those regional communities that are the threat. It's the, as we've heard so far, the concentrated cases in the northern beaches and potentially the wider Sydney community.
So the only safeguard we have against someone driving down from the northern beaches and coming into Victoria, into Melbourne, is a random spot check?
The evidence shows that overwhelmingly people from, whether it's into West Australia, Queensland and Victoria, that the travellers from the northern beaches areas are coming by plane. But in regards to anyone from those northern beaches areas, if you are leaving, you are breaching your own government's request, and as of 5 p.m. today, your own government's order that you not leave those areas. So if there is anyone from the northern beaches contemplating coming to Victoria by road, don't. You will spend your Christmas in hotel quarantining. If you come by plane, don't. As we've seen today, there is one family from the northern beaches area who will spend their Christmas in hotel quarantine in Victoria. That's in the interest and the safety of all Victorians and our hard-won effort to get to the position of 50 days straight of COVID-free.
How many checks on people? I mean, obviously, if someone's come since December the 11th, before the permit system was introduced at midnight, is there any way of keeping across those people?
Yes, those people have been contacted initially by SMS text messages, have been followed up with phone calls. Yesterday, we identified an initial 300 people from the Northern Beaches area in that group, and they are subject to both visits by authorised officers and check-ins by phones, so as to make sure that that group are self-isolating and protecting both themselves and Victoria's hard-won status of 50 days COVID-free.
How did the two miners manage to board the plane in the first place, given they're in the care of airline crew, and we were told yesterday that they'd be checked at the Sydney end as well as here?
That's a good question. We're working with Melbourne Airport and the airline so as to establish how that happened. That clearly speaks to some issues at the Sydney end of things, and we're going to follow that one through to make sure that that doesn't occur again. However, I was really pleased that our authorised officers and our systems at this end of the system worked, and that we were able to identify those unaccompanied minors and their carer so quickly and issue them detention orders and get them straight into hotel quarantining.
So their carer was already here?
Their carer was already here from that 11th of December to the 17th of December group, and as a result of their unaccompanied minors appearing in Melbourne, all from the Northern Beaches, all three have now gone into compulsory hotel quarantining for the next 14 days.
Passengers at the airport are reporting that it's pretty loose, that they're not being asked to show any proof of where they're from, that they're worried that people from Northern Beaches aren't being allowed into Victoria.
All the advice I've got is that the system is working pretty well, that all the flights are being met by authorised officers or DHHS staff, all in full PPE, and that they're all being provided the material around their obligations and their requirement to provide their permits. And that's in fact how this particular family were identified.
You started this press conference by celebrating the fact we're now 50 days of no community transmissions. Why are we putting that at risk by not disclosing the order now?
Well, we're working on the basis, as we always have, of taking the best public health advice in the most timely manner. We will not hesitate to take any measure that is needed if that's recommended. At the moment, the recommendation is to deal with the hot zones, the red zones, in the northern beaches local government area in particular, but a number of other and an increasing number of other exposure sites across Greater Sydney. If the evidence points to seeding of the virus across Greater Sydney, then that will see, without hesitation, the advice, if it's made by the public health teams, to treat Greater Sydney as a red zone, then we will act. And that will mean that anyone coming from Greater Sydney will be spending their Christmas in Melbourne or in Victoria in hotel quarantining. That's not a Christmas that anyone wants. So I'd urge people from Sydney to please reconsider your plans and not come to Melbourne, not come to Victoria, and people from Victoria. I know it's not the message we want to be hearing at this time of the year, but please reconsider your plans of travelling to Sydney.
Isn't that waiting for the horse to bolt, though, by the time all of Sydney is declared a red zone?
No, I don't believe so, because we're working very closely with our Sydney colleagues, and it is literally an hour-by-hour conversation as to how the epidemiological evidence shows where the outbreak is. And as we've seen today from our New South Wales colleagues, all the cases are able to be linked back to that cluster around the Avalon Bowling Club and the Avalon RSL, either directly or indirectly. Having said all of that, increasingly, as Professor Sutton indicated at this time of the year, more and more people are moving around, and as this virus takes a period of time to incubate, if there is any evidence that the areas of Greater Sydney have had the virus seeded into them, then I'm sure our public health officials will consider that, and if that evidence is there, then we will act on that evidence.
Just to confirm, you said that people from the orange areas are encouraged to get tested. So when they arrive at the airport, is that just optional whether they go to these testing stations?
So that's correct. If you're in Victoria at the moment from the 11th to the 17th from Sydney, then you need to get tested, or you're strongly encouraged to get tested. We've seen a high uptake actually of those people getting the advice at the airport. For instance, we saw a bit of a backlog at the Royal Melbourne Hospital as a stop-off zone as people were coming from the airport to get tested. We quickly moved with our friends at the hospital and dealt with that, and I'd encourage anyone who needs to get tested. There are up to 200 testing sites right around Victoria. Just hop onto the department's website, coronavirus.vic.gov, and you'll find the one closest to you. And I was pleased to see, in a way, that there was that drop-off point from the airport. It shows the system is working, as does the capture of the international person, flight crew person, as does the identification of the family from the northern beaches. Our systems are in place. They're always being tested. They're always being reviewed, and we'll continue to build them, as you would expect a high-performance response that we have in place and continue to build to respond to.
Right, a couple of questions.
Sure.
Would it be fair to characterise the situation as you would expect if we need to move to putting Greater Sydney as the red zone, that would happen likely in the next 24 to 48 hours, pretty quickly?
I think we'd consider it at any point into the future. At the moment, it really does depend on those day-by-day numbers. Yes, it's in consideration, it's in play over the next 24, 48 hours, absolutely. But if it stabilises and then goes awry later, it's still a consideration. It'll always be a consideration. But we're watching extremely closely over this next 24, 48-hour period for sure.
And what about the rest of the state? Do you think it's unlikely that the whole of New South Wales would be, will you close the border to the whole of New South Wales?
Well, I think if that's felt to be a requirement, yes, we would. The reality is Greater Sydney went through months and months of low-level transmission, including up to 10, 15 cases average per day, without significant seeding into regional New South Wales. So that's worth reflecting on. But it's also absolutely the case that over the Christmas period, people will be moving into regional New South Wales more than they might have 3 months, 6 months ago. So we have to bear that in mind. If there were any cases in regional Victoria, we'd review on that basis as well. And if we have to make a hard border at the border, we'll do that.
How are you feeling? I think everyone in Victoria had a collective sense of relief, and now it's almost, we were discussing, it's like we've got a bit of post-traumatic stress disorder. How are you feeling having to go into this again just before?
Nobody wants this to be the case in Australia. Nobody, certainly not Sydney and Victoria, having made the enormous sacrifices we have made. There's no question that we want to be as precautionary as we possibly can be. It's also a reality that our border communities have actually been hit as hard as anyone in Victoria, economically, financially, in terms of work and the constraints that have been placed on them. So we need to have a consideration about what the actual risk is just across the border in New South Wales, and regional New South Wales is not anything more than a negligible risk at the moment, I think. But we do have to consider protecting the status of Victoria as COVID-free in terms of community transmission, and we'll be appropriately anxious about that, because we don't want seeding into Victoria. And of course, we've got in mind everything that we've been through over months.
Could we have cases here already?
I think it's unlikely. There's one case per 10,000 people in the Northern Beaches. It's a population of 250,000 people. Many thousands are stepping up for testing in that area right now. So I think, especially those who are symptomatic, but even those who are not, are being tested. And so, that's terrific in terms of finding out where cases are. And obviously, their close contacts are being quarantined, and we'll watch that very closely. So the risk is there, but I think it's very low. And obviously, we're placing strong obligations on people not to come. They will go into mandatory quarantine if they arrive here from the Northern Beaches or other hot spot areas. But also there are penalties that can apply. There are fines up to $1,600. There are penalties up to $9,000+ plus. So those are also available for people coming in